Your kidneys. Two small bean-shaped organs, each about the size of a fist. They sit quietly in your lower back, but don't let their size fool you. Every single day, they filter your blood, remove toxins, balance your body's fluids, and even help control your blood pressure. In many ways, your kidneys are silent heroes, working tirelessly to keep you alive and well. But here's the problem. Millions of Americans are living with kidney disease, and most don't even know it. In this video, we'll explore how your kidneys work, what can go wrong, the warning signs you should never ignore, and most importantly, how you can protect these vital organs for a lifetime of health. Let's start with the basics. Your kidneys are part of your urinary system. You have two of them located on either side of your spine, just below your rib cage. Each kidney contains about 1 million tiny filtering units called nephrons. These microscopic structures clean your blood, separating waste and extra water, which then leave your body as urine. But that's just the beginning. Your kidneys control blood pressure by managing fluid balance and releasing hormones. Regulate electrolytes like sodium and potassium, which are critical for your nerves and muscles. Produce a hormone called erythropoietin, which helps your body make red blood cells. Keep your bones strong by activating vitamin D. Think about it this way, if your kidneys stop working, your entire body is thrown out of balance. That's why they're so essential. Kidney disease is far more common than most people realize. In the United States, about 1 in 7 adults, that's nearly 37 million people, are estimated to have chronic kidney disease. Shockingly, as many as 9 out of 10 don't even know they have it. Why? Because kidney problems often start silently. In the early stages, there may be no pain, no obvious symptoms, nothing to alert you, but damage can build up slowly over years, eventually leading to serious complications, even kidney failure. There are many different kidney-related conditions, but let's talk about the most common ones. These are hard mineral deposits that form when urine becomes concentrated. Passing a kidney stone can be extremely painful, often described as worse than childbirth. They're common, but usually treatable. A UTI that travels up into the kidneys is called pyelonephritis. This condition can cause fever, back pain, and requires prompt medical care. So, chronic kidney disease is a long-term, progressive condition where, the kidneys slowly lose their ability to function. CKD is often linked to high blood pressure, diabetes, and, obesity. Now, unlike chronic kidney disease, acute kidney injury develops suddenly, often due to things like dehydration, infection, or even certain medications. The good news is it can be reversible if treated quickly. So who is at risk? While kidney disease can actually affect anyone, some groups are definitely more vulnerable. Diabetes is, the #1 cause of kidney failure. High blood pressure, puts a lot of strain on the tiny blood vessels inside the kidneys. Heart disease. It's important to remember the heart and kidneys are closely connected. So, obesity is, actually linked to both diabetes and high blood pressure. Family history is important too. Genetics really do play a role in certain kidney diseases. And, age matters as well. Kidney function naturally declines as we get older. Certain medications, especially the long-term overuse of painkillers like ibuprofen, can really damage the kidneys. It's something to be mindful of. One of the biggest challenges with kidney disease is that, the early stages often have no clear symptoms. But as the condition progresses, you might start to notice signs such as fatigue or low energy swelling in the ankles, feet, or around the eyes, and trouble concentrating. There could also be changes in urination, like foamy urine or going more or less often. Blood in the urine, persistent itching, muscle cramps, and even shortness of breath can occur. It's important to pay attention to these signs. If you ever notice these symptoms, don't ignore them. Talk to your healthcare provider right away. The good news is, simple tests can check kidney function. These include blood tests, measuring creatinine and estimating your glomerular filtration rate or eGFR. Urine tests, looking for protein or blood in the urine. Blood pressure checks, since high blood pressure is both a cause and effect of kidney disease. Regular checkups are especially important if you have risk factors like diabetes or high blood pressure. Early detection can make all the difference. So what can you do to keep your kidneys healthy? Prevention is key. Stay hydrated. Drinking enough water helps flush toxins and prevent kidney stones. So maintain a healthy diet. Focus on fruits, vegetables, whole grains, and lean proteins. And it's important to limit salt, processed foods, and sugary drinks. Control blood pressure. Aim for below 120/80 if possible. Manage diabetes. Keep blood sugar within target ranges. So, it's important to exercise regularly. Aim for at least 30 minutes most days of the week. And it's best to avoid smoking and excess alcohol. Both can really damage your kidneys and blood vessels. Also, be cautious with medications. Don't overuse NSAIDs like ibuprofen. Always, and I mean always, follow your doctor's instructions. It's really important to get regular screenings, especially if you're in a high-risk group. If kidney disease is detected, treatment will depend on the cause and the stage, Lifestyle changes like adjusting your diet, getting regular exercise, and managing your blood sugar and blood pressure can make a big difference. So, let's talk about medications. These are used to control blood pressure, reduce the amount of protein in your urine, or even treat complications like anemia. Dialysis is another option. For advanced kidney failure, a machine steps in to filter the blood for you. And finally, a kidney transplant. In some cases, surgery really is the best option for long-term survival and a better quality of life. Medical advances are giving patients new hope, but honestly, prevention and early action are still the most powerful tools we have. Being diagnosed with kidney disease isn't the end of the road. With the right care, many people live full and active lives. Education, support from healthcare professionals, and lifestyle adjustments can make a world of difference. Communities, patient networks, and kidney foundations across the United States provide resources and support to help patients manage their condition. Your kidneys may be small, but their impact on your health is enormous. Protecting them starts with awareness. Know your risk factors. Pay attention to early signs. Get regular screenings if you have diabetes, high blood pressure, or a family history of kidney problems. And, most importantly, make healthy lifestyle choices every day. Let's work together to spread awareness about kidney health. Because when it comes to your kidneys, prevention is always better than cure. Remember, every step you take to care for your kidneys matters. Stay informed, stay healthy, and support those around you.